Hey everyone, it's Dr. David here from El Paso Manual Physical Therapy. Hello and welcome to our live stream for today. We're going to be talking about, should I be worried about clicking noises in my knees? And specifically, I'm going to be answering the question from one of our viewers, Sahana M, who asked, Doctor, I have damaged my medial meniscus in right knee, and because of that, I'm getting crunching sounds by doing these exercises. Does that problem go away? Please suggest. And he gave us that question on a video that talks about 5 glute exercises to do for knee pain. So I'm going to be talking all about that. But before I get into all that stuff, I want to let you know that we are live right now. So you can ask questions in the chat here or comment if you're catching this on the replay, and we'll get back to your questions as best as possible. And please comment if you can hear me. Just say hello and tell me where you're from, so that I know that my audio equipment here is working so that you can hear me just fine. So just say something in the chat, please. All right, so let's get into it. To answer your question directly, Sahana, I'm sorry about the crunching sounds that you're getting in your knee. The glute exercises that were in that video that we posted about the 5 glute exercises to do for knee pain will absolutely help you with your knee crunching sounds. Now, I can't guarantee the knee crunching sounds will go away for anyone. Even if we see them here in the clinic, it's rare that it goes away completely. But if it's painful, then hopefully it should bring the pain levels down. It should reduce the irritation to your meniscus. A injured meniscus can definitely cause noises to happen in the knee whenever you're moving it, as well as other things like damaged cartilage behind the kneecap and on the end of the thigh bone as well. All right, we got some comments coming in. Al Dif Allah Bani Hamad, great. Thanks. From Jordan in the Middle East, fantastic. Thanks for joining us. And then we have Elizabeth from Las Vegas. Hey, Elizabeth, nice to see you here. All right, so when should you worry about your knees? There's 3 situations that you need to be worried about if your knees are making noise, and you shouldn't really worry about it unless there's 3 things happening. Number 1, if you have pain. If the noise happens and you also have pain, it doesn't have to happen at the same time. It might happen at the same time. But if you're in a situation where your knees are hurting in the morning, your knees are hurting when you bend your knees, like if you go down to kneel or during exercise, and you also have noise associated with the pain, like it happens at the same time or at other times in the day, then you need to be a little bit worried about that noise in your knees. Now, another time is if it's getting louder. If you notice that, hey, my knees are much louder now than they were yesterday or last week or last month. More commonly, people notice it over the time frame of months to years. They'll say, well, I'm older now, a few birthdays have passed, and I remember my knees making a little bit of noise when I would go to get up from a chair, but now it makes a lot of noise, like the other person across the room heard it. Then that's of concern as well. It may not be a sudden increase in noise. It may be more of a gradual noise as well. And then the third one is if it's becoming more frequent, like you hear it more often throughout the day as you're doing your normal everyday things, like, walking around your house, getting up and down from chairs in your home. A common one that we hear is getting up and down off of a toilet or squatting down to the floor to pick up something from the ground. That's a real common time to hear crunchy noises in your knee. And if you feel it more frequently, like you're noticing it's happening more throughout the day, even if you don't have pain, then that's not a good thing. You need to be worried about that. So I got another comment here. Susan, your exercises have been terrific. Thank that and added turmeric. Love you. Oh, I love you too, Susan. Thank you for doing our exercises. I'm glad you're benefiting from them. Turmeric is definitely a good anti-inflammatory supplement that you can take. I love turmeric. I take it myself. All right. So if you have those conditions, you have pain, your noise is getting louder in your knees, and then it's more frequent, then you need to be thinking about what's causing your knee noise, what's causing the noise. And I haven't even mentioned this yet, but in the medical field, they call this crepitus, crepitus, crepitus. It's the medical term for noise coming from your joints. It tends to happen mostly in the knees. That's where people can feel it. You can easily put your hand on your knee. It's right in front of your body when you sit down. and you can usually just bend and straighten out your knee and make it make noise. So it's of concern for most people because they're going to notice it quite a bit. Now, it can come on for a variety of reasons. The most common ones are going to be arthritis, a meniscus tear, like I'm so sorry. Let me get your name, Sahana. Sahana was dealing with a meniscus, a medial meniscus problem. Arthritis, a ligament problem is another one, and then also cartilage damage. All of those things can cause the joint to move inappropriately, or the surfaces that they're moving on can be a little bit rough, because inside your joint you should have smooth surfaces so that there's as little friction as possible as you're bending your joints. But when there's damage, like old damage to the joint or current damage to the joint, and the surfaces of the cartilage become kind of rough, they're not smooth anymore, then you start to get more friction, and that friction can cause sound waves to happen. So that's why you get noise coming from your knee joints. So those are the reasons why this happens. If you guys have any questions about the noise, please chime in here. I'm happy to field any questions. I'm going to go over the root reasons. There's 3 root reasons that this crepitus develops, the noise inside your knee develops. The first most common reason is that there's been an old injury. Like if you're in your 40s or older, this is when it typically happens. People have had enough time to where they were very active in their younger years, and maybe as a teenager, if you did sports through school, or you even did collegiate sports, and you were running a lot or on your feet a lot, soccer, American football like we do here, football like the rest of the world calls it, soccer is what we call it in the United States, cricket, baseball, all of those things, running for exercise, they can contribute to added forces inside the knee joint. And you may have had injuries in the past that are now showing up as you age. And people get it worse and worse as arthritis progresses, as meniscus tears progress as well. This can the crepitus can become more intense. If you had a ligament injury in the past, like a torn ACL, an MCL, LCL, or PCL injury, those are all the big ligaments inside the knee, then those ligaments connect the joint together. I have my knee joint here. The ligaments are inside the knee and around the knee, and they help to connect the bones to each other. And if you've got an injury to one of those, then you're going to have a looseness in the knee that might result in like a clicking or popping sound. Usually that's a louder click or pop, and it's usually like one big click or pop rather than a crunch or like a gristly, sandy sound in your knee. That's usually like a cartilage grinding sound that's happening in the knee. That's not usually related to a ligament issue. And you can, of course, have multiple things happening together, like a ligament issue with a meniscus tear and cartilage damage and arthritis can all be happening together. But if you've got that, then that's one of the root problems to your knee noise. The other 2 root problems are related to each other. The first one that I'm going to tell you is a muscle imbalance. I talk about that all the time in this channel, and it's so important. It's the reason why most musculoskeletal injuries happen. Muscle imbalances are usually painless when they first start out. They are undetected by doctors, undetectable by x-rays or MRIs. But you have them when you have other symptoms developing, like arthritis or this grinding sensation in your knee, the popping, clicking, or crunching sounds in your knee. That's a result of the muscle imbalance causing too much pressure at a given joint. And in your knee joint, the most common muscle imbalance is your quad muscles in the front of your thigh are way too strong. So they're causing a lot of tension to develop, and it pulls the kneecap up against the thigh bone here. And because there's a ligament that connects the kneecap to this bone right here, the shin bone, it will also pull the shin bone up into the knee joint and cause compression right in this space inside the knee joint. And if that is there for a long period of time, then you start to wear away at the meniscus, the cartilage in there. You can develop arthritis. Another way to think of this imbalance is if you think of your hand and you just loosely bend your fingers just like this, it should feel fine and normal and easy to do. But if you tension up some of the muscles in your fingers like this, there's muscles that bend every single knuckle in your finger. And if you tension up the outer ones and then you try to bend these knuckles, you'll feel increased tension going through these knuckles. And if you were to bend and straighten your hand like this all the time with everything that you do, because you can't free these up, or you just have those muscles in use all the time, then it's just a matter of time before you wear down the joints, the cartilage, the other tissues that are inside these joints. But of course, we use our hands openly. As long as you don't have any problems, you're going to be gripping like this. When a knee joint, if you're using your thighs all the time, the front of the thigh here, the quad muscle, and that's how you walk, that's how you sit, that's how you stand, that's how you exercise, that's how you do all the things in your life, then you're going to be adding that extra pressure right here all the time when you shouldn't be using that muscle all the time. You should be secondarily using it frequently, but you should be driving or walking with your glutes. You should be going up and down stairs with your glutes. You should be focusing on doing exercises with your glute muscles up here on the back of the hip. Because when you use those glute muscles, you can shut off the quads right here on the front and decrease the pressures and move more normally as you walk and do all the things that you have to do throughout the day. So the third root reason that's going to contribute to the noise in your knees is that pressure that I was just talking about. So it's the muscle imbalance, but then that pressure buildup that's here in your knees. Oftentimes people don't know how to address it. Doctors aren't going to be able to tell you because it's not their training. They're looking at what's torn, what they can treat with medicine, what they can inject, and that will give you temporary relief. But if you can figure out how to undo this muscle imbalance, which takes some time and exercise, then you'll be all right. You can reduce the grinding, crunching, popping sensations in your knee, normalize the pressures inside your knee, and you should be able to reduce arthritis effects, meniscus effects, even heal your cartilage and meniscus inside your knee joint. So that's the reasons for the popping and clicking in your knee. Guys, if you have any questions, jump in here. I've got some comments I'm going to go through here. I've just got a few more minutes before I got to go. All right, D. Falah Bani Hamad. Can good diet help knee arthritis? Thank you. Absolutely. And good diet is kind of vague. What you eat 100% is going to influence your joints. The lower inflammatory foods are going to be better for you because in arthritis itself is joint inflammation. That's what the word literally means. It means your joint is irritated or inflamed. And so if you eat foods that are going to reduce the inflammation, then you're going to help out your knee arthritis. You still got to look at the imbalances and the pressures inside your knee joint, but it's going to add to your case. It's going to help you out if you can eat better. Inflammatory foods are typically like anything with sugar in it, basically like extra sugar. Now, carbohydrates are, when I say sugar, I mean like carbohydrates. I use that interchangeably. Carbohydrates are good to a degree. You need to have some in your diet for sure. But the quick carbohydrates, like from sugar and flours, those tend to aggravate your joints, and you want to generally avoid those as much as you can. In moderation. Holidays come around for me, or celebrations, and I'm having a slice of cake. The weekend comes, I want to have some candy or something nice, but during the week I try to cut that stuff out, and I generally feel better overall. And for most people that are dealing with arthritis, they'll report the same thing. We tell them to do that here in the clinic, and consistently they feel better when they get off the quick, simple carbohydrates, the sugars or what it typically is, and starches. Some sneaky ones that we've told people to cut back from their diets that are in their diets and they're not always aware of are potatoes and rice. Those are starchy foods that can spike your blood sugar and cause irritation inside your knee joints and all your joints, really. So you want to try to eat more vegetables, more greens. Legumes are pretty good. Legumes are higher in carbohydrates than like a green vegetable like spinach, kale, those kinds of vegetables. But they're released much more slowly than simple carbohydrates, so they don't have the same spike in your blood sugar, and they actually will fill you up. So I'm a big fan of legumes. We do legumes just about every day, some version of them. Okay, Mini Kiriko, is it okay to wear rubber support for the knees? And then you had another follow-up. Is it okay to wear garter support for the knees when walking? So your question's about like wearing a knee brace and can you wear it while walking? Absolutely, you can. Now, if you're looking to do this for reducing the crunching sounds from your knees, it may or may not help. I can't guarantee that it will or won't. it comes down to the pressures in your knees, and the knee brace is not going to decrease the pressure in your knee. A knee brace is only 100% necessary if you've got ligament injuries, because ligaments hold the bones together. And if they're injured, you're going to have a lot of extra motion that happens in the knee. And so having the right brace on is going to give it support so that you can move more freely when you're walking without irritating those ligaments. You give them a chance to heal. But if we're talking about arthritis or meniscus problem, you need to actually offload the knee joints, and braces don't really do that very well. So I wouldn't bother with a brace unless you feel like it helps you. Now that's the key differentiating factor here. If you feel like you put a brace on and your arthritis is better, go for it. It's not going to hurt you. If you feel like your meniscus feels a little bit better when you put on a knee brace and you can walk more like that, great. But it's not going to solve the meniscus problem or the arthritis problem. You got to look at that muscle imbalance. But it's a good deterrent from using pain medications, and it might keep you out of the doctor's office so that you're not having to go get an injection and can delay a surgery while you're fixing the muscle imbalance. But it's fine to use a knee brace. We tell patients to put them on if you feel like it, but it's only really a requirement for us here in the clinic if you have a ligament issue. All right, we got a few more comments here. Tahira Naeem, hello from Pakistan. Great to have you on here, Tahira. And then Susie Wan NG, Dr. David, hello from Australia, from Newcastle, Australia. Awesome. Wow, it is dark on your side of the world right now. Thanks for joining us right now. I appreciate you taking the time. All right. Susan from Denver, Colorado. Fantastic. Hey, you're in Mountain Time Zone with us. Fantastic to have you on here. Thanks so much, everyone, for joining us. I appreciate you guys jumping on these live streams. We'll be doing them every Monday. And comment on here if you're catching this on the replay. If you thought this was helpful for you, give us a thumbs up. Share this with somebody who needs to hear this. There's people with crunchy knees all over the world that are worried and concerned about, is it a good thing? Is it a bad thing? How do I know if I need to go see somebody? What should I work on or not work on? And I hope that this information clears it up for you. Thanks so much, guys. We'll catch you in the next video. Bye-bye.